What's up, guys? All right, so I'm Dr. Chris Park, family physician, addiction doctor, and this is a question I've been getting a lot just this week. And of course, I've gotten it before. I've been meaning to shoot this video for a long time, and I just couldn't remember it. So thanks for being persistent, guys. The question is, can you take Suboxone for pain? So can you take Suboxone for pain? Yes. When I say Suboxone, what I'm talking about is the medication Buprenorphine. Buprenorphine is in Suboxone, Subutex, Sublocade, Zubsolv, Butrans, Belbuca, and probably some other medicines that I'm forgetting. But buprenorphine has been used for pain for a long time, particularly in like Europe, all right? Now, it's only technically approved for the use of chronic pain in the medicine Butrans, which is a patch, and Belbuca, which is like an oral, a buccal mucosa application. And there may be another brand name that I'm just kind of forgetting right now, but they're approved for pain. And so Suboxone and Subutex is just basically approved for the treatment of opiate dependence. But a lot of times a patient will come to me who has chronic pain and a history of opiate addiction. And so we'll use buprenorphine to get them off pain medication. But because their pain is a trigger, they may end up staying on a low dose so as not to relapse. So it helps to control their pain, even though it doesn't take pain away. Nothing will take your pain all the way away, okay? Life is painful, all right? But it just helps them, live their life, basically. Not having to worry about pain medicine, not having to worry about relapsing, and not having to worry about just being in severe pain every single day. That's why I get so upset when people get in the comments and they're like, oh, you should never stay on this dose of Suboxone for X amount of time, right? And I had some patient, or not a patient, I'm sorry, some commenter, kind of doing something similar to that. And I was like, well, that's probably not, my patient with colon cancer wouldn't want to hear you say that, or doesn't think you're telling the truth, or whatever. I can't remember how I responded, but it's just strange to me how like some people who've never actually helped anybody else, how they just think everybody should be pigeonholed into whatever they did. Whatever they did that worked must work for everybody because everybody's the same, right? Well, no, everybody's not the same. We all have different stories, different backgrounds, different trauma, and this is not a cookie cutter thing, okay? Treating addiction, treating chronic pain, treating depression, anxiety, post-traumatic stress disorder, it is not cookie cutter medicine, all right? So please, guys, don't try to do this at home, off the street. Find a doctor. It'll make a huge difference in your life. But anyway, this video is not supposed to be about that. It's supposed to be about chronic pain. So basically my answer is yes, Suboxone does help for chronic pain. And just because you're on Suboxone doesn't mean you can't take some other medications for pain. Now, obviously, we want to stay away from opiates, right? But some other medicines can be useful for pain, such as like Neurontin or Lyrica. They're kind of similar. Now, Neurontin has been abused by some people, and so it could be possibly addictive as well to you. So I would say, use those with caution. But again, this is why you need a doctor to help you through all this. You can take non-steroidals and all, like ibuprofen, Aleve, Mobic, Meloxicam, Celebrex, those diclofenac. So those type medicines are typically okay as long as your medical history, you can take those medicines, right? Muscle relaxers, sometimes you can take, muscle relaxers are typically okay to take while on this. Now, again, not everybody's different, so this is not medical advice for you. Talk to your doctor, but that could be an option for you. So you're not just because, and I had a patient I was trying to get to go to pain management, and he's like, they're not going to see me, they're not going to treat me. I was like, yes, you have options, okay? And especially if you go to them saying, look, I don't want opiates. I'm on this medicine to keep me from taking opiates, but I still hurt. What are my options? They are going to be relieved because they know you're actually seeking help. You're not just in there to try to get a prescription filled, okay? So maybe you had a bad relationship with chronic pain in the past, but there might be some options for you now, okay? But, I mean, obviously you don't want to go to some wacko pill mill clinic. You want to go to a legitimate clinic. And it doesn't necessarily have to be a chronic pain clinic. You know, your family doctor can help you, but they need to know your history. They need to know what medicines you're on. They need to know you're on buprenorphine, okay? What else? There's also some other psychiatric type medicines that we use for chronic pain, especially if you have fibromyalgia. So if you have fibromyalgia, your doctor may want to try you on Cymbalta, which is an antidepressant, but it's also been found to help with pain. Lyrica, like I mentioned before, is also useful in fibromyalgia pain. With fibromyalgia, let me tell you that the best thing you can do is stay active, and it's to exercise, man. It's to get out there and make yourself sore, which you're gonna be sore anyway, right? And you think, it's not gonna help me, but yeah, it's been found to be more effective than pain medication for fibromyalgia. So, like if you have a lot of arthritis issues, you may want to try something that's kind of non-weight bearing. So like in a swimming pool would be ideal. But if you can't do that, maybe on a bicycle or stationary bike, or now they've got these new cool adult tricycle bikes. My mom's got one with a basket. She puts her puppy dog in there. Like there's different options, things you can try to stay active, even if you're have a lot of pain issues. Another thing that is so, I was about to say overrated, underrated. Something that's so underrated is yoga. I've got a buddy who's suffered with back pain forever, has had back surgery, has been on opiates, done everything. Started getting great results because he found like the right physical therapist and started doing yoga, like the Diamond Dallas Page yoga. Look that up. Diamond Dallas Page yoga, DDP yoga. Yeah, I'm talking about the former wrestler guy. Yeah. So there's other things out there that you can try, like acupuncture, which some physical therapists do acupuncture now, and they call it dry needling. So your insurance might cover dry needling, even if it wouldn't cover you going to an acupuncturist, okay? Sometimes those things are helpful as well. So maybe you just need to take a different approach from it. But if you're on buprenorphine, that's going to help with your pain. Let me tell you, if you're on a high dose buprenorphine, you're probably not going to be able to, I find very little reason to then go to opiates. And I'm not talking about like with surgery or whatever. I'm talking about like with if you have chronic pain issues, because you're probably not going to find an opiate that will control your pain as well as buprenorphine. Now, that's just my opinion. I think that buprenorphine is the future of chronic pain management because it seems to help and it doesn't have a lot of the problems we have with short-acting opiates and having to escalate doses over time, etc., building up tolerance and dependence and whatever. Now, obviously, buprenorphine has its own set of problems, right? Because you can get on buprenorphine and not be able to stop it, which is why we do the videos on how to taper off. So yes, there are problems with buprenorphine. I'm not saying it's a cure-all by any means, and you should really consider all your options before you start something like buprenorphine for chronic pain. But if you have a history of opiate addiction and you have chronic pain issues and you know that you stop your buprenorphine, you're going to relapse, maybe you need to stay on buprenorphine. So, I don't know. What do y'all think? What other questions do you have? For those of you who've asked me before about chronic pain issues, did I answer your question? Do you need more information? Do you need more details? Guys, I hope you have a great day.